What is the leading thought as to why Black women experience more maternal morbidity mortality than white women? And I know Dr. Decimo alluded to some of this, but could you expand on that?
I think that a big part of the problem is implicit bias. So I can just use the state of Utah here as an example. When women go and receive their prenatal care, if they have a provider that doesn't look like them, or for example, that doesn't look like me, there's part of being human where we all have these biases. And racial bias is one that a lot of people don't want to admit or don't feel like applies to them, but it's there. It's in all of us, and it's affecting the women who are having babies in this state. So I feel like a big part of that solution would be to have a provider that is like
culturally competent,
okay. A provider that's culturally competent and aware of implicit bias, and aware of that potential within themselves. That way they can not project that onto their patients, or they can not let that affect their care that they're giving.
Or maybe just a provider that will just know from viewing this video here this afternoon that Black women have a 3.2 times chance of dying in childbirth,
yeah,
and immediately thereafter than a white woman in this nation. So yeah. I think that striking statistic hasn't reached everyone, and that's what we're trying to accomplish this afternoon.
Right.
I completely agree with that, and I would also add that, the racial biases aren't just don't just happen on individual bases. I think that it's important to also acknowledge just the historical and currently structural and systemic biases that factor into the differences in maternal morbidity and mortality for majority and minority women. So, I think that healthcare providers need to do a better job of checking their biases, and I think the healthcare system has improvements that it can make in terms of just the quality of care that it's delivering to all their patients. But I think it's also important to keep in mind that there's kind of factors that are outside of the healthcare system that need to still be reckoned with in this country.
So would you say some of those factors fall under social determinants of health?
Definitely. I think that there are a lot of socio-demographic aspects that don't fully explain why there's disparities in healthcare outcomes, but they definitely don't help. So if you have a certain portion of the population, a certain demographic of the population that has to deal with food insecurity or unstable housing, difficulty getting to their prenatal care appointments, these are all things that won't help any situation in terms of having improved outcomes.
Okay. Would you say also access to medical insurance is a big factor?
Definitely. Access to care is another big one, and I think that falls under the umbrella of kind of socioeconomic factors that may contribute to different health outcomes. I think one thing that's important to mention is that for the state of Utah, there's a House bill that currently has not been passed, but hopefully in the future will get more traction, that expands coverage for women, especially in the postpartum period. So just acknowledging that once delivery happens, there's still considerable risks for women, and trying to cover them with healthcare through a year postpartum to try and mitigate some of that risk that they may incur during the postpartum period, which is just as important as during the pregnancy itself.
So even just through legislation, we could possibly lower the mortality rate, at least at our state level.
Hopefully.
This would benefit all women, not just women of color.
Exactly.